This is now part 2 on the universal healthcare show. You need to check it out if you didn't see the first part. Watch it. Number 7 says, this sounds like another excuse from left field. Okay, government mandated procedures are like to reduce doctor flexibility. How? Okay, here's the thing: when you're having all this extra money come from taxpayers, you can hire more doctors, you know? And like I said, last I checked, I've seen Sicko. I don't know if you've seen Sicko, but Michael Moore, you know, he's a pretty good guy, you know, and he goes over there. He went over and he questioned them with pretty much all these excuses right here. And it's not poor patient care, and none of the patients were complaining, you know? And actually it was like a lot smoother, you know what I'm saying? Okay, people come in, because the doctors don't have to worry about if we're going to get their money from this patient or not. You don't know. They're not worried about it. They're wasting their time, you know? Their money is going to get to them regardless, because they work for the government now. So I don't see how it's going to reduce their flexibility, lead to poor patient care. All you have to do is get some more doctors in there, because you can never have too many doctors, you know? Never. Number 8 says, this right here I think is really messed up, because even, okay, it's trying to say that healthy people wouldn't have to go to the doctor, which is crap, because even if you are healthy, you still have to take care of yourself. You still have to go to the doctor, you know? So therefore, those people who smoke and are obese, like, I know a lot of smokers that don't even go to the doctor, okay? So why are they paying tax for health care if they wouldn't even go to the doctor? You know, they smoke, they don't have any other health problems. They're still paying taxes for that healthy person to go to get their checkups. So I mean, turnabout's fair play, you know? I mean, and if you have these benefits, free benefits, universal health care, then why would you not take advantage of them, you know what I'm saying? So it's just an excuse, for an excuse, to me. The people who are healthy don't want to take care of the sick. Well, sick people still have to pay taxes too, so they're going to be paying for the healthy people who have their checkups too. It's just an excuse. Number 9. Okay, I read this and I was like, wow. Okay, and here's why. As soon as I read it, a long, painful transition will have to take place involving lost insurance. And insurance really wasn't stood out to me, but lost industry jobs is what really stood out to me. There's a lot of people who now don't have a job, or they have a family to support, and they go from making $25 an hour to 10 and some change, because their jobs got moved out of the country to who knows where. That was a painful transition, and some people are still having to go through it, you know? Business closures and patient record creation. Okay, that right there is an excuse, but it's all an excuse because the same things happened when our jobs went to where they went to, you know? People were out jobs, families, you know, had to suffer and were hungry, you know? This is why we should have government health care, because these people right here, they're suffering because of something that the government did. But the government doesn't want to have their back, you know, and do something about it. It's really messed up. Okay. Number 10. Like I said, I've seen Sicko, and the doctors over there, there's reduced pay is no way that they're gonna have any kind of reduced pay, you know? Okay, he interviewed quite a few of them, and every single one of them was well off. Okay, now I'm not saying that he didn't edit those things out, but you know, if you've watched any of Michael Moore's documentaries, you know he's not one for lying to you about them situations, you know. And it also says lots of private practice options. Okay, this is a give and take situation. Okay, Maybe they might not they might not get to have the private practice that they want. No, but because they're doing a private practice, that money comes out of their pockets. This way, they wouldn't have to put in that money up front. They wouldn't have to worry about, okay, I'm going to have my own private practice business. What do I have to do? How do I have to afford it? They wouldn't even have to worry about that. They're government employee now, so therefore they're put where the government wants them to put. And I'm not saying it's like they're going to place them, have them moving all over the world. No, because they wouldn't do that. But they're going to put them in a location, tell them this is where you are. And if they're going to be doing something they like, it's not like they're not going to have a person who went to school to be a dentist, be a neurosurgeon, they're just making excuses for things and like taking it, making it sound like it's this really bad thing when it's not. Okay, you know what I have to say to that? Okay. Like I said, it does sound like a bad thing, Well, yeah, malpractice lawsuits and this, that, and the other. Okay. If you look at most malpractice lawsuits, accidents happen, okay? And then the issues with that is they want them to pay to redo it, sometimes, Especially if it's something that's, like, not life-threatening, Okay, this way, with universal health care, they wouldn't have to worry about redoing or recorrecting an operation or surgery, like breast implants went wrong, I'm not saying that this needs to be for universal health care, because I understand that certain procedures, people would still have to pay for, but I'm just giving this as an example. Woman gets implants, doctor messes up her implants, and she complains about they're not the way that she wants them, this, that, and the other, okay? This was covered by universal healthcare, government-run healthcare. It's less likely that she would have a problem. Yes, it's going to be upsetting and it's going to be, it's going to be depressing for a while. But the doctor can simply go in here and be like, okay, I messed up. Let's redo it. With the money coming from the taxpayers, then the situation would be as bad because, okay, the money's here. Okay, I made a mistake. Most doctors aren't going to, say that they didn't make a mistake or anything. It just happens, right? And so they're easily corrected. And plus, with the money coming from taxpayers, then they can do more research and mistakes are less likely to happen. It's not like a doctor's going here to a chop shop. Okay, this patient doesn't have that great of health care, and I know that they're not going to be able to afford everything these prices are cost. We're just going to do a hack job, whatever happens, woo, it's not going to be like that. It's, they're taking something and they're showing the negative of the situation, like, okay, malpractice could happen with everybody having surgeries that they need, this and the other, okay, yeah, but when the people can afford it, okay, they're just going to be thankful that something happens, and like I said, if it's government-run healthcare and if accidents do happen, not life-threatening, something that can be easily refixed, something that can be easily repaired with another surgery or whatever might need to be done, the money's not coming out of their pocket, so I don't see why a doctor would have a problem with saying, okay, I'm sorry I made a mistake, let's do it again. Simple as that. Number 12. First things first, it has right in parentheses, like it's not a person's right to be healthy, especially whenever we have the technology, you know what I'm saying? So they're saying it like it's not our right to be healthy and live a long, prosperous life. It's just an excuse because they don't want to give it to us anyway. They get too much money off of it, out of the way the government is now. But I think it is a right to be healthy. Look at all these other countries that have universal health care. To be such a powerhouse, we don't have universal health care. But all these other countries who are quote-unquote lesser developed, I guess is what you want to call it. I don't know what's politically correct, and I don't want it to seem like I'm looking down on any other country or anything like that. But we're behind, And it hadn't got out of control anywhere else, so why all of a sudden would it come to the United States and say, oh no, we can't handle this, we gotta take it back from our public. It's a lot of things out here that are just really messed up. And I think this is one of them. Because I think the public deserves universal health care, It's only fair.